Not so merry, overcoming loneliness and depression and sadness in the holiday season. If we haven't met, I'm Dr. Orlando Landrum. I'm a physician that helps patients understand how to be able to deal with issues, whether it's physical or mental, and how to be able to know your options for being able to live the best life that you can, live longer, and live better. We know that the holidays are frequently characterized as a time of joy, of laughter, and celebration, or at least so we would think that's the case. Frequently, that's truly not the case. For millions of people, Christmas and New Year's can feel like a mountain of loneliness, stress, and it can just cause a sensation of being alone, where the season feels heavier than others. Traditionally, when we think about this, we think that it should be some time of happiness, but the harsh truth is holidays just can be incredibly difficult and downright heartbreaking for many. In a 2022 survey by the National Coalition of Mental Illness, 64% of people were found to have some mental health condition symptoms that were worsened during the holidays. So what does this mean? Let's break it down. When we think about mental health, there's a number of things that are in play. As mentioned, about 64% of people are living with a variety of mental health challenges, and frequently they're affected by the holidays. So depression affects around 21 million adults in the US, and major depression is frequently worse during the holidays due to financial stress, grief, and seasonal affect disorder, which symptoms worsen during this time. In addition, anxiety disorders are worsened as well. They affect about 19% of adults in the United States. Anxiety disorders are often worse with the holidays. Social anxiety spikes during family gatherings and parties where we expect for you to do certain things or you try to be able to meet the needs of different individuals. And financial worries can heighten generalized anxiety. Bipolar disorder affects about 2.8% of adults in the United States. And traditionally, this is disrupted because the schedules and overstimulation of holidays can actually cause this to result in destabilizing depressive or manic episodes. PTSD is present in give or take about 6% of the population, and we think that this may be an undervaluation, and it can be triggered during the holidays because of painful memories that are tied to either the family or childhood or other issues. Substance use disorders affects nearly 21 million Americans, and during this time, many Americans are vulnerable during the holiday season, which results in increased alcohol secondary to increased emotional triggers. Eating disorders are about 9% of the US population deals with. And during the holidays, because of meals and social commentary, it can just make things difficult and make dealing with food something that just gets out of hand and gets to be used as a crutch in order to be able to deal with challenges. Obsessive compulsive disorder affects nearly 2% of Americans, and holiday specific challenges with the need for perfect decorations or concerns about contamination and fears in crowded areas increases compulsions and challenges. So, addition to all of that, let's not forget that 3% of adults live with borderline disorder. And those individuals have emotional highs and lows, and this certainly can be exacerbated with family conflicts, which can be especially painful. So millions struggle during this time, and we don't always think about that being the case. But mental health is complex, but there is hope. And there's a number of different treatments and ways to be able to deal with this. First of all, there's ways to be able to navigate this by looking and seeking connection with other individuals who can be understanding. In addition to that, there are actually other interventions that can be useful too. So for those struggling with symptoms, severe symptoms, innovative treatments can actually sometimes provide value. One of which is something that's called TMS, which stands for transcranial magnetic stimulation. It's a non-invasive procedure that uses magnetic fields to stimulate parts of the brain, which are linked to mood regulation. For those who haven't found relief with traditional type medications, TMS has been shown to be even stronger in being able to provide benefit to those who have had resistant depression. Ketamine is another utilization of a different type of scientific technique. Low dose ketamine is used to be able to improve mood and is different than that is characterized and stigmatized by the media as a quote unquote party drug. In this context, it works on certain brain pathways and is able to ease severe depressive symptoms pretty quickly, almost immediately. In addition, there's another type of treatment that's called TDCS, which stands for transcranial direct current stim. It's a portable, non-invasive device that delivers low electrical currents that actually augments brain connectivity and is able to enhance mood. And it doesn't have any sequelae or side effects like traditional depression medications have. And it can be able to improve both depression as well as anxiety. In addition to this, one of the things that can be utilized in order to be able to combat that holiday blues is connection and finding ways to be able to rebuild that sense of belonging. So whether you look towards doing things like community volunteering through platforms like Volunteer Match and doit.help, they allow for you to be able to connect just locally and find ways that you're able to get outside of yourself and be able to help someone and be able to create a purpose. There's other areas and means by joining a meetup or support group with websites like meetup.com or virtual support groups that can be able to help you if you're feeling those sentiments of loneliness and disconnection. In addition, one of the things that you can think about, but you really want to consider this with some degree because they are dependent upon you, just like you're dependent upon them. And that's the possible consideration for adopting a pet. And by adopting a pet, you can be able to get some degree of companionship and purpose, but clearly they need you. And so you don't want to just make that outreach and leave them high and dry. But if you're looking for that mutual support and undivided love, it may be something to consider. If you need to reach out for support, you can look for crisis text hotlines like home, or rather texting home to the following number, 741-741. And they have 24/7 confidential support. So all of these are different mechanisms of how to be able to deal with what is expected to be this season of cheer, but it's not always the case. If you're feeling lonely and you're feeling stressed, remember that you're not alone. Millions of other people understand exactly what you're going through, and there is a way forward, one small step at a time. If you found this video helpful, please hit the like button. If you think that this may be something that can be able to bring light to someone and let them be able to know that there's a path through the darkness, share the video. If you'd like to be informed about other treatment options or just how to be able to kind of understand what are some of your challenges and the options to be able to deal with them, hit the subscribe button. And we'd love to be able to get you in a place where you can be able to do the things that you want to be able to do and live a long and productive life. Thank you so much and have a great day.